Hey everyone, and welcome back to the channel. Today, we're going to talk about something that's often difficult, something many of us might avoid thinking about, but something incredibly important. Recognizing the subtle changes that might indicate an elderly loved one is entering the final chapter of their life, perhaps within the next year or so. Has someone you care about seemed different lately? Maybe it's small things you've brushed off as just getting older. A little more tired, maybe eating less, perhaps seeming a bit more withdrawn. It's easy to miss these quiet signals, especially when life is busy. But the truth is, the end of life often isn't a sudden event. The body frequently gives us gentle warnings, signs that things are beginning to slow down. Recognizing these signs isn't about being morbid or giving up hope. It's about understanding, preparing, and most importantly, using the precious time we have left to offer comfort, support, and love. It allows us to shift our focus, perhaps from aggressive treatments to ensuring quality of life, peace, and dignity. So today, let's sit down together, like old friends having a quiet chat, and talk through 7 common, sometimes subtle, signs that might appear in that final year. We'll draw on insights from healthcare professionals and organizations who support families through this journey. Remember, everyone's journey is unique, but understanding these patterns can make a world of difference. Let's begin. Number 1, a noticeable decrease in energy and mobility. This is often one of the first things families notice, but it's more than just typical tiredness. We're talking about a significant increase in fatigue and weakness that doesn't really improve even with plenty of rest. Maybe you've noticed your mom or dad is sleeping a lot more, needing frequent naps throughout the day. Perhaps tasks they used to manage easily, like getting dressed, making a simple meal, or even walking across the room, now seem exhausting. They might describe feeling profoundly weary, or you might observe a visible reduction in their strength and stamina. In some cases, as things progress, even basic movements like lifting their head or shifting in bed can become difficult. Why does this happen? Well, as the body naturally prepares for its final stage, organ systems begin to slow down. The heart might not pump as efficiently, circulation can decrease, and the body starts conserving its precious energy, prioritizing essential functions over physical activity. It's not laziness. It's a profound physiological shift. Seeing someone you love lose their vitality like this is hard. It can be frustrating for them too, especially if they were once very independent. The key here is understanding and acceptance. Allow them the rest they need. Adjust expectations. Focus on making them comfortable and finding small ways to connect that don't require much physical energy. Number 2, significant changes in appetite and weight. This is another really common early sign. Have you noticed your loved one losing interest in food? Maybe meals they used to love are now left untouched, or they're eating much smaller portions. This often goes hand in hand with unintentional weight loss. Clothes might suddenly seem looser, or you notice a visible difference in their face or frame. It's not just about being picky. The digestive system naturally slows down as part of this process. Interest in both food and fluids can decrease significantly. Sometimes there can also be physical difficulties, like trouble swallowing food or even pills, which can further contribute to reduced intake and weight loss. Families often worry and try to encourage more eating, offering favorite treats or supplements. And while ensuring comfort and hydration is important, Forcing food when the body is signaling it doesn't need or can't process it well isn't always helpful and can sometimes cause discomfort. If you see significant unintentional weight loss coupled with a decreased appetite, it's a sign the body's priorities are changing. Focus on offering small, easy to digest foods they might enjoy, ensuring they have fluids available, and prioritizing comfort over calories. Number 3, increased confusion or cognitive changes. This one can be particularly difficult for families. You might start noticing changes in your loved one's thinking or mental clarity. Maybe someone who was always sharp seems more forgetful, easily confused, or disoriented, especially later in the day or at night. They might struggle to follow conversations, repeat themselves, forget familiar names or faces, or lose track of where they are or what time it is. This isn't just normal age-related forgetfulness. It can be more pronounced or accelerate. What's happening here? Similar to other organs, the brain needs consistent oxygen and nutrients. As circulation perhaps slows or other bodily systems decline, the brain's function can be affected. Sometimes you might even see periods where they seem perfectly clear, followed by episodes of confusion, almost like their mind is fading in and out. It's heartbreaking to witness, feeling like you're losing pieces of the person you know. The temptation might be to correct them constantly or try to reorient them, but often the kindest approach is patience. Speak calmly, offer simple reassurance, perhaps use gentle touch if appropriate, and create a calm, familiar environment. Meet them where they are in that moment. This can be such a challenging aspect. Have any of you experienced this with a loved one? If you feel comfortable sharing gently in the comments below, perhaps how you navigated it, it might help others feel less alone. And if you're finding this conversation helpful, please take a moment to give this video a like. It really helps us reach more people who might need this information. Number 4, social withdrawal and disengagement. Alongside cognitive changes, or sometimes independently, you might notice your loved one starting to pull back socially. Someone who used to love family gatherings, phone calls with friends, or pursuing hobbies might show less and less interest. They might prefer to be alone, limit conversations, or seem unresponsive to what's happening around them. It's not necessarily that they don't care anymore. Often, it's a combination of factors. The fatigue we talked about makes socializing exhausting. Cognitive changes can make interactions difficult to follow, and there can be an internal turning inward as the body focuses its energy. They might stop engaging in activities they previously enjoyed, not out of boredom, but because they simply lack the physical or mental energy. This withdrawal can be gradual. Maybe they start declining invitations, then shorten phone calls, then seem content to just sit quietly. It can feel like rejection, but try to understand it as part of the process. Continue to offer your presence, even if it's just sitting quietly with them, holding their hand, or playing some gentle music they enjoy. Let them know you're there without demanding interaction. Your quiet company can be incredibly comforting. Number 5, more frequent infections and slower healing. Have you noticed your loved one seems to be getting sick more often? Maybe battling recurring urinary tract infections, UTIs, bouts of pneumonia, or skin infections that just won't clear up. Or perhaps small cuts or bruises that used to heal quickly now take a very long time. This points to a weakening immune system and potentially compromised circulation. As the body declines, its ability to fight off germs and repair itself diminishes. Infections that might have been minor before can become serious and harder to treat. Sometimes antibiotics don't seem to work as well as they used to. Interestingly, the signs of infection in the elderly, especially near the end of life, might not be typical. Instead of a high fever, you might just see increased confusion, more lethargy, or a further decrease in appetite. Slow healing, especially of wounds or pressure sores, particularly if mobility is limited, is also linked to reduced blood flow carrying essential oxygen and nutrients to the tissues. While medical care for infections is important, recognizing this pattern of increased frequency and difficulty recovering can be a sign of the body's overall weakening. The focus may need to shift towards preventative care, like good hygiene, skin care, and managing symptoms for comfort, rather than solely aggressive cures. Number 6, changes in breathing patterns. This is a sign that often becomes more noticeable as time progresses, but subtle changes can start earlier. Pay attention to how your loved one is breathing. Is it shallower than usual? Slower? Are there noticeable pauses between breaths? Sometimes breathing might become irregular, perhaps speeding up for a bit, then slowing right down. A specific pattern called Cheney-Stokes breathing, which involves cycles of deep, rapid breaths followed by pauses, can occur, though often this is seen closer to the very end. You might also notice increased shortness of breath, even with minimal exertion like shifting position in bed or trying to speak. They might need to breathe through their mouth more often. These changes happen as the body's need for oxygen decreases and the respiratory system becomes less efficient. Sometimes, fluid can accumulate in the lungs or airways, leading to noisy or gurgling breathing sounds, sometimes called a death rattle, though this usually occurs in the final hours or days. Seeing or hearing these changes can be alarming. While medical interventions like oxygen might sometimes be used for comfort, these breathing changes are often a natural part of the dying process. Keeping the person calm, perhaps elevating their head with pillows, and ensuring good airflow in the room can help. We're covering some really sensitive ground here, and I appreciate you staying with me. Which of these signs, if any, have you perhaps observed or found most surprising? Share your thoughts below if you feel up to it, and if you haven't already, consider subscribing and hitting the notification bell so you don't miss future conversations like this. Number 7, significant changes in sleep patterns. We touched on increased sleepiness under fatigue, but let's look specifically at sleep patterns, as distinct changes here can also be a sign. Are they sleeping much, much more than usual, sometimes for most of the day and night? Is it becoming increasingly difficult to wake them? Alternatively, sometimes sleep patterns can become completely reversed. They might be awake and restless during the night, but sleep soundly during the day. These shifts reflect the body's slowing metabolism and changing internal clock. The profound fatigue contributes, but it's also part of the body detaching and conserving energy. As alertness decreases, the periods of sleep naturally lengthen. It's important to allow this sleep. Trying to force wakefulness can be distressing for them. Create a peaceful sleep environment, ensure they are comfortable, and use their awake periods, however brief, for gentle connection and care. So, those are 7 signs: decreased energy, appetite and weight changes, cognitive shifts, social withdrawal, frequent infections, breathing changes, and altered sleep patterns that you might observe in an elderly loved one during their final year. Seeing these changes can stir up a lot of emotions, sadness, fear, maybe even denial. That's completely normal. But acknowledging them isn't about giving up. It's about shifting our perspective. It's about understanding that the body has its own wisdom and is preparing for a natural transition. This knowledge empowers us. It helps us make informed decisions about care, perhaps focusing more on comfort measures, palliative care, or hospice support when the time is right. It gives us the chance to have important conversations, to say the things that need to be said, to mend fences, or simply to be present and offer love without expectation. It allows us to cherish the moments of clarity, the shared smiles, the quiet handholds. It helps us ensure that our loved one's final chapter is filled with as much peace, dignity, and comfort as possible. Remember, you don't have to navigate this alone. Talk to healthcare providers, seek support from hospice or palliative care organizations if needed, and lean on friends and family. Thank you so much for spending this time with me today on such a tender topic. I truly hope this conversation has offered some clarity or comfort. What's one takeaway from today's video that resonated with you? Please share it in the comments below. Reading your insights means a lot and helps us all learn from each other. If you found this video valuable, please give it a thumbs up, subscribe to the channel for more supportive content, and maybe share it with someone else who might be going through a similar experience. Your support helps us keep these important conversations going. Take care of yourselves, be gentle with yourselves and those you love, and I'll see you in the next video.